Welcome to the deep dive. We're here to take your source material, pull out the really key insights, and get them straight to you clearly, quickly. Our mission today, a sharp look, a really focused look at some sources about specialized healthcare.
Okay, so let's unpack this one. The material we have, it zeroes right in on abortion services, but analyzing them, specifically as a type of specialized women's health care. And the focus is even tighter. It's information about a provider in Las Vegas, a competitive market there.
Yeah, and what's really striking is how the sources set the tone immediately. Right off the bat, they describe these services as a critical aspect of women's healthcare.
Yeah.
That framing is everything. It tells you this isn't like an optional or peripheral thing in these documents. It's defined as vital care from the get-go. Vital and critical. That's the starting point, exactly. Because from there, from that idea of necessity, the sources quickly pivot to the personal side of it. They stress that choosing the right clinic is a deeply personal and important decision. So that's the lens, right? The human filter we're using here. We're not just looking at abstract data. This is about information designed to help someone, navigate very specific, often very sensitive medical decision. And that decision-making process leads us straight to the provider mentioned in our sources. Medica Center Fem in Las Vegas. Now, the sources position this place pretty clearly. What does the material actually tell us about why this center supposedly stands out? How does it claim to be different?
Well, it's fascinating. The language they use is immediate and it's strong. The source flat out calls Medica Center Fem a leading provider in Las Vegas. Now, you see a phrase like leading provider, especially in healthcare. And, as analysts, we have to pause. We have to ask, okay, what does leading actually mean here in specialized medicine? And what's the source implying backs that up? Is there evidence suggested?
That's the million-dollar question, isn't it? Because leading can just be marketing speak. So do the sources give us any clues, any hints about metrics or maybe their style of operating that might support this high-status claim? Are we talking patient numbers, special techniques, reputation? What is it?
It implies a couple of things, I think, that are important for you, the learner, to grasp. First, in specialized fields like this, leading status often does suggest high volume, lots of procedures. And high volume usually means, deep experience, maybe greater efficiency. That's one angle. Second, it often points to specialization. Maybe they have specific techniques or technology that you wouldn't find in a general clinic or hospital. So the sources are essentially signaling that this center operates, supposedly, at a level beyond just the basics, offering a specialized setting for a sensitive procedure.
Okay, so leading provider speaks to reputation, maybe scale, maybe specialization. Let's pivot then to the service itself, the what. What do they actually offer? The sources make a pretty fundamental claim here. The center provides comprehensive care. Now, that term, comprehensive, really needs unpacking, especially in this context.
Oh, absolutely, it does. Because when a clinic is dealing with something, the source itself calls both critical and deeply personal. Comprehensive can't just mean they do the procedure. If you think about quality healthcare more broadly, comprehensive care suggests a much more robust structure around the main service, like wraparound support.
Okay, so what does that actually look like, practically speaking? If I'm the patient and I'm told I'll get comprehensive care, what is the source implying I should expect beyond just the medical appointment itself?
The implication is breadth, definitely, and preparation. So comprehensive care here. It almost certainly has to mean things like extensive pre-procedure counseling or consultation. And not just giving information, but being supportive, making sure the patient really understands the medical side and the emotional scope of their decision. It probably also implies logistical support too, like clear scheduling for follow-ups, making sure patients know how to reach someone if there's an issue later. It's about managing risk, providing total support before, during, and after.
That does set a high bar. It's definitely not just the procedure then. It covers the whole patient journey, timeline-wise. Okay, so that's the what. Now let's shift to the how, the approach. Beyond the list of services, the source highlights a compassionate approach. Is that just about, hoping the staff are nice people?
Yeah.
Or does the source suggest this is more systematic, of methodology?
Well, to be really meaningful, especially in a setting like this, it kind of has to be systematic, doesn't it? When a document like this mentions a compassionate approach, it signals that the facility likely has actual formalized ways to manage the emotional and psychological climate. It's not just crossing your fingers that staff are kind. It's about building kindness, building respect right into the process, into the system itself.
Right. So we might be talking about things like really strong patient privacy protocols, maybe specific support staff who aren't the main medical team,
Right.
or maybe intake procedures carefully designed to, reduce stress and keep things confidential.
Exactly that kind of thing. The source is signaling a patient-centered way of doing things. Because the decision is framed as deeply personal, this compassionate approach is meant to ensure the physical care happens in a setting that really acknowledges and respects the patient's emotional state. It speaks volumes about the clinic's operating philosophy, how they view the person, not just the procedure.
That's a really important distinction. Okay, so comprehensive covers the scope, the thoroughness. Compassionate covers the method, the dignity. And we can tie this all together, right? This combination, the broad care and the careful delivery method, it links back to the bigger promise the source mentions, the main commitment.
Precisely. The whole model they're describing seems built on this one, single promise, an explicit commitment to patient well-being. If you sort of step back and look at the picture the source paints, that leading provider status, the comprehensive services, the compassionate approach, they're all presented as pieces driving towards that ultimate goal, patient well-being.
It really acts like the philosophical anchor for the clinic model described. It's the thread connecting the external image, the leading provider bit, with the internal standards being comprehensive and compassionate. The source is essentially giving the learner, giving you, a claimed profile for what high-quality specialized care looks like according to them.
That's the core analytical takeaway here. The sources are providing you with a framework, a way to judge in a really specialized area of medicine. Yes, it's a checklist of attributes on the surface, but the deeper point is that for any facility to operate effectively in this sensitive space, they apparently need to weave together status, scope, and approach, all into one unified, patient-focused commitment. It suggests, none of these things work in isolation. They have to reinforce each other to deliver the claimed level of care.
And what we've tried to do here is go beyond just listing those claims. We've unpacked what those terms seem to imply functionally in this specific critical healthcare context. So wrapping this part of our deep dive up, what does it all mean? We've used the source material to establish really two key things. First, how the source itself defines this area of medicine as a critical part of women's healthcare. That's foundational. And second, we've broken down the claimed operational standards of this specific Las Vegas provider, Medica Center Fem, emphasizing how things like clarity and comprehensive care are promised in what everyone acknowledges is a deeply personal medical situation.
And the sources, they really lean into this idea of choosing the right clinic. They put significant weight on that. And the words they use, comprehensive, compassionate, leading, that's the language of high quality, isn't it? So for you, the learner, the key takeaway, I think, is to start thinking about how any facility actually translates that kind of promising language into reality, into tangible practice. The source material gives us the blueprint, the goals of quality care. But the real question, the one we'll leave you with to maybe explore further, is this. Beyond the claims, beyond the nice words, what concrete proof does a facility offer? Things like specific patient policies you can see, or required staff training modules, or maybe clear evidence of follow-up procedures. What shows that compassionate care, for instance, is truly baked into how they operate day in and day out in this incredibly personal field. That's the kind of depth you need to look for next.